How's everybody doing? Are we awake? It's been a long day so far, but it's been good. So we'll try and keep it somewhat light and entertaining.
Yes.
More dialogue involved in this one. We're going to talk about mental health and social connection, the importance of how being connected in all aspects of mental health treatment plays such an important role in all of this. Like she said, I'm Brian Bauer. I'm the founder and executive director of the Abundance Foundation. We're a nonprofit based in Colorado. We do substance abuse treatment and mental health support for all low-income people transitioning out of treatment centers, homeless shelters, jail, prison, those type of things. So I'll have a different perspective on how this plays into all of that, but I guess we'll just kick us off and get us started, and we got a couple questions to kind of get things going here, and then we will just kind of see where it flows from there. But our first one on the list, let me pull it up real fast, is, all right, so just have everybody introduce yourself, what your organization is, what your title is of your organization, and then what is the primary example of how you have seen connection and social support positively impact mental health. And if you just want to, whoever wants to go first, we can go from there, and we'll just take it and see where it goes.
Hello. Hi, everyone. My name is Dr. Angela Misra. I'm a psychiatrist based in the UK, and I work in rehabilitation and complex care, which also crosses over into forensic care, so prisons, probations, etc. I'm also the CMO of Criterion Associates, and we specialize in detox in the inpatient community, and we have a digital platform as well that we're working on. So the question is a very important question. So the positive, the positive impact of connection. I think the reason why I got into this profession and this particular field is I actually believe that people can change. I believe that with enough support, they have the capacity to change. And I think that's really important to have that fundamental belief to start off with. I believe that when you're dealing with an individual, it's really important that we already have evidence for this. So we understand that when a child has negative connections or is disenfranchised or has a difficult relationship with their family, they are more likely to have adverse child events. They're more likely to have mental health issues later on in life. I think this is an established fact that everybody knows. So the reverse is true, and I think we need to be more focused on building those positive connections and understanding that a person isn't just a person on their own, they are a system. So having a systematized approach to rehabilitation is incredibly important. So one of the things that I have been working on is developing a carers framework. So we look at the individual, we look at the carers, we look at the community they come from, we look at their cultural understanding, we look at their faith-based background, and we look at how we can tailor this so it's individualized approach. I think even if you look at it from, I'm coming from, for example, myself, a South Asian background, it isn't enough that I project my understanding of what my culture is on another individual. Culture is dynamic. So I think it's about understanding what that means for the individual and tailoring the approach appropriately. But I do believe the power of connection is evident.
All right, my name is Kinjal. I am a founder and a CEO of Swasthya by Kinjal. Swasthya means health and wellness. I promote veganism. And also, in the January, new publication coming out about myself that I'm a immortal queen. So I'm here to give awareness on humanity to become immortal. It's all spiritual journey and spiritual awareness on healing yourself first and helping others. So the reason why I become vegan is after pregnancy, I was going through body shaping issues, and I wanted to regain my focus and the journey of healing myself and refining myself, restructure, rebirthing, and self-love, self-respect, self-value, and all of that. So my whole issue was to help myself first, then the others. So by doing that, I was able to help me and my new babies and the family by getting the knowledge and the education on wholesome food diet, the vegan, and creating new recipes for me and my family helped me through to not only heal myself, but the whole entire family. So that does play a part. So I believe that healing yourself, that's the number one key to furthermore to heal others.
Good afternoon, everyone. My name is Najla Wortham, and I'm the president and CEO of the Rock Creek Foundation. We are located in the United States, a Maryland-based organization. We also have a subsidiary in Chester County, Pennsylvania. We serve individuals with intellectual and developmental disabilities, as well as severe and persistent mental health diagnosis. So individuals at the intersection of IDD and mental health, as well as other co-occurring disorders. I believe that social connection is very significant and profoundly impacts someone's mental health. From what I see with individuals we support, oftentimes because they have been forensically involved in the criminal justice system, state hospital system, et cetera, they often lose a lot of their connections. And so when they are able to enroll in an organization like Rock Creek, we work directly with them to regain those social connections, whether it's with those family members in which they lost those relationships with, whether it's with their friendships, co-workers, et cetera. And we see an immediate reduction in symptom interference, depression, anxiety, et cetera. So I believe that social connections is pivotal to mental health, mental well-being.
Good afternoon. My name is Michelle Grigsby Hackett. I'm the CEO of Affiliated Sante Group. We are a nonprofit behavioral health and crisis response organization that is based in Maryland with locations in North Carolina in the United States. In the work that I do, I see social connection as being very necessary and meaningful for the lives of individuals that we serve. We serve individuals with complex mental health and co-occurring substance use conditions, as well as individuals who may come into a crisis situation, whether it be a family conflict or even an accident or even major disasters. So social networks are very important to individuals we're social beings, right, by nature, and it's important to feel like you have a connection with someone, with a friend, with a loved one. And oftentimes we've seen individuals that come into our care have also lost those connections. So helping them be able to reestablish new connections, build new networks, be able to support how they can communicate well with others, how they can be in our communities and feel like they can successfully make those relationships and those connections are critical to just their well-being and ensuring that whenever they're experiencing a challenge, that they have others to lean on through that time.
Happy afternoon. Happy afternoon. I always believed you don't have to conquer the world. You have to conquer the imagined self. Hi, I'm Anasuya Jagannathan, a psychotherapist and a hypnotherapist. I'm a founder of Embrace Life. While speaking about healing and social connection, if I have to speak from my personal experience, I've had amazing social support. Right? While the contrast was throwing towards me in my life, be it through situations with people or circumstances, I had an amazing social support. But that led me to understand whatever social support you have, or however stronger the social support is, if you are not connected to yourself, it becomes very difficult to sustain and have a better mental health. Right, so I would speak a little different from here. So here I would talk more about the connection to yourself. When you're connected inside and you're real and authentic, that would automatically give an elevated, positive connection around you. So that really helps in having a steady mental health.
One thing that is this on? Yeah. Well, one thing that I'm noticing as a theme in this is the aspect of the cultural differences of things. Is that what have you seen? I guess is the differences in that it's made in terms of different cultures and being able to get people to buy into the idea that connection is the answer to the mental health crisis, because I've noticed, like, depending on the culture, a lot of things are looked at as you need to handle this in isolation and not in connection. Have you noticed that there's different cultures where it's more difficult to make that breakthrough to get people connected in that respect?
I can speak just briefly, just from the work that we do. We have very diverse populations, and so one of the things that's really important is understanding the culture of those that you are working with and that you're connecting with. And once you understand the culture in which you are communicating or connecting, and being able to approach or have discussions from that perspective, so that there is a common bond, there's an understanding between the individuals that are engaging, and taking culture into account is very important. It comes from respect, right? Being able to learn, right, and be open to learn from different cultures. I think that's a critical component.
So just to add, because I completely agree with you, I think it's about, for me, it's like cultural humility and understanding that, you don't actually know. And it's about asking the right questions and really understanding what it is from their perspective. I think, what you're talking about a bit more in terms of culture is obviously there is a big stigma associated in certain cultures of mental health, and that is a big barrier to being able to provide those social connections, because a lot of the time it's, let's keep this person in isolation and treat them, as you were saying, so that nobody else knows that this is going on. And I think there is an ongoing global conversation that mental health is something that needs to be addressed. I think we're getting there. I think there is an openness now, but I think we've still got a lot of work to do.
Yeah, absolutely.
While we have diverse cultures, but if we have to look at mental health or emotions, emotions are universal, right? So when we are trying to connect to ourselves and we go within and we try to understand ourselves much better, and your connection to yourself is much better, then the connection towards the outside world is also better. Right? So irrespective of the culture differences, I feel emotions are universal, and so it is more important that how you connect to yourself and others.
I guess I'll fill in on my part of the first piece of that too. So I've been in recovery myself for a little over 13 years, and I was in my active addiction for over a decade. So it's pretty close. I've just passed that time of like how much time I was in active addiction and then how much time I've been sober for. So in my active addiction, it ended up in isolation, but a lot of my addiction was based on connection too. So I had this ability, like that's what I was always seeking out, was the connection piece. So like my internal self was always craving to be connected, even if it was unhealthy. And so it became craving, like as much as the addiction was drugs and alcohol, it was craving the connection piece, even though it was not benefiting my life at all. And so once I ended up getting sober and needing to focus on me, so having that, building that relationship, like you said, with myself, it became this piece of, I don't even know, like the hardest part of getting into it is I don't even know where to start. Right, we'll get to that in just a second, but I didn't even know where to start at. And so fortunately I had this solid group of men take me in, and I just followed them around everywhere. Like they were going to the gym, and I went to the gym, and I were going to the grocery store, and I went to the grocery store, and they were, whatever they did, I was just doing that. And they went to church, and they went to service, and they were doing community outreach things, and I just did what they were doing for a long enough period of time that the same way the negative environment had the influence on me, the positive environment did too. And so I think it was because the standard of that group was, the bar was set super high. And what I've realized is that people are always going to go to whatever the bar is set at. And I think, I don't know how it is in other parts of the world, I'm kind of learning that at this conference in a lot of ways. But in America, we set the bar way too low. And people go to what the bar is set at. And they think that if people are struggling with mental health and are struggling with substance use, and we just need to keep the bar low because they can only do so much, and that's not true. Addicts and people that suffer from mental health are capable of way more than people give them credit for, and we've been able to show that through what we're doing in our organization, where people are transitioning out of jails and prisons that have been there for a significant number of years. We're having people come out of prison that didn't have cell phones and are coming into the world as it is today, and they had never had a cell phone before. And so learning how to just be connected through that, and and one thing that people don't realize is the value of people coming out of those environments and how strong of relationships they're able to build because of those things that they've been through. People that come out of prison are super loyal people when they come to employees and building community and connection, because when they find who they need to be connected to, they're very dedicated to it because they value it. And so we're like putting all these roadblocks in the way of people of getting the help that they need, when in reality, their path that they've gone through is a superpower compared to other people that haven't had to go through the struggle to get to the same place. And so, what we've been able to do is get people from these environments, from homelessness, from jails and prisons, from low-income situations, and put them in an environment of having a high standard. And there's a gap in there where they're like, I can't do this, this is too much, I can't take it, I'm gonna quit. And then 30, 60, 90 days into it, the switch flips. And then as soon as they can figure it out, as soon as that happens, then all of a sudden, everything takes off. And it's just somebody showing them in that environment of what they're actually capable of in a real life setting, and not locked away in a treatment center. And so as soon as we start to do it in real life settings and have people that are interacting with each other in real life settings that have a high standard set, you start to see that come about. So.
All right, for me, it was more of a family situation, siblings and peer pressure, and bringing me down, not listening to my story or my symptoms, and criticizing me and all of that. So I went within to find answers and refocus myself to listen to my inner voice, and going through the spiritual journey from there on to heal myself. So I was early on educating myself about these issues and all that, to understand what kind of environment am I in. Is it good for me or bad for me, or where I should shut my mouth or open up, where are people to listen to me or relate to me to help me or anything like that. So I was able to early on to recognize those kind of environment, and to smart enough to exit it out or open up where people are genuinely willing to help me or listen to my problems. So that plays a bigger role in where you stand and where you're going and who are you interacting with.
I would agree with you, and thank you for saying that, because we do a lot of work with the individuals we support, helping them advocate for the social connections that are healthy for and meaningful for them. And whether or not those social connections understand what they need in their lives or what they want for their lives, we really allow them to champion for those things. So thank you for sharing that, because we do a lot of work around self-advocacy as well, and that's very, very important.
I think the other thing I would say that is not only important and commendable about sharing your story is the vulnerability. Being able to be vulnerable in those connections, because building trust and being able to rely on someone, it requires you to be vulnerable and to share things that sometimes you don't feel safe sharing. And so when you are building those connections and you find individuals that you can, one, have a shared experience with, you know, and when you share those deep stories and somebody can say, you know, I've been there too. This has happened to me as well. That's when, you know, you start to build that network.
All right. How about what would you all say is one practical, low barrier way that people can get connected to start addressing mental health if they're struggling in some way? And what would be some ideas that you have around that? And the reason that I ask that is on a weekly basis, we provide a dinner for people in the recovery community where we have about 100 to 120 people show up, and there's no stipulation behind it. We just ask that they're not high or drunk when they come. But we get people in the community together. There's no stipulation as to who can come, what it's going to be. It's just 100 people having dinner together that are all in recovery. And out of that, I mean, it started with, during COVID, it was myself and one other person that were meeting on a weekly basis. And now it's grown to this where, you know, for Thanksgiving, we had 5 turkeys and 3 hams, and it was a massive thing. But that seems to be a very low barrier thing. There's no qualifications to show up. There's no treatment that's involved. It's just come be part of the group. So what are some things that you all have that could be things along those lines?
So that's so lovely, by the way. I think that's so nice, because I think it's just encapsulates the point of connection. I think, you know, for me, from my experience, being a psychiatrist for about 15 years now, what I've noticed, it's not so much the medication, it's not so much the formal treatment. It is someone genuinely believing they can change, sometimes when they don't believe they can. And having that sort of hope and building that therapeutic relationship has been undoubtedly the most consistent thing. And the way that I sort of try, I think I think the lowest kind of barrier thing is to actually have a conversation, and it doesn't have to be, and for it to be no pressure, which is similar to what you're saying. It needs to be a no pressure engagement, and really understanding that there is an energy transfer when you're communicating with somebody. So if you're coming in, and I know it's very difficult because there's a lot of moral injury at the moment as healthcare professionals, like we want to give more than we can. There are limited resources, you know, we're tired, you know, all of these things, but it's so important that we take care of ourselves and that we're able to be positive when we're having these conversations so that they can feel positive too. So that would be my suggestion.
I would say peer pressure, stigma, calling out names, or keeping them in isolation, that is a very wrong thing to do. So please involve them in every teeny tiny activities that you do, either family or non-family or any social gathering. They are part of your community, and that's how they move towards positivity. So please include them.
Yeah. With more of connection, if I have to say, when I've been working with the Bangladeshis, Pakistanis, Nepalis, or even Africans for the underprivileged community, the most that they value, or what we can see, is the presence. Yeah, you being present there for here and now. So as we all know that even in this conference, we are here more for networking and knowing each other, the primary reason why we are there in this conference. While having that as an agenda, are we present? Are we real? Yeah. So the more real that we are and the more present we are to another person, irrespective of the culture, caste, creed, or race, is the biggest gift that you can give as a support, and that's going to be an healing within you and to others, right? So just being there. So for me, one go-to, what I would say the teenagers, including my daughter or even in my seminars, is create one connection today, where there is no agenda, no networking, no performance, yeah, no boardroom meetings, no appraisals, just being you. Can we do that? That while we're going from here today, we could create just one connection without any of these agendas, and that presence of yours will begin healing, and that connection would also sustain.
And I would just add that I think it's also about making sure that you provide the accessibility, right? You have to make sure that the connection is organic, that it's accessible, that there are not a lot of external barriers that impact an individual's opportunity to engage in those social connections. So we do a lot of matching the individuals we support together, their likes, their interests, their preferences, creating organic opportunities in the community for them to engage together. So I think making sure that it's always accessible is key.
And what I would add is sometimes part of the barrier or challenge with building a connection is similar, Brian, to what you said. How do you get started? What is even the first thing I say? You know, that can create a barrier internally of, I don't know what to say. I don't know how to approach someone. So being able to, one, take the risk, because we're all going to say things, we're going to mess things up, right? That's just normal. I'm not going to always get it right, but having people be comfortable in saying, it's okay. It's okay if I mess up your name. I apologize. Can you help me? You know, so being able to have someone, sometimes it's not okay. See, I mean, you have people that will be open, but also if you have someone that you can practice with, even if you can't practice with or role play with someone, role play in the mirror, right? Having the opportunity to practice those skills, especially if they're skills that you haven't tapped into in a long time, especially in healthy environments.
Yeah. Basically, social support or any connection that what we are looking at is each one of us wants to be seen, wants to be heard, wants to be validated, wants to feel important. Yeah. So these are the core. So I drive this point again is because when you do not feel that within yourself, for yourself, how is that you're going to show up for others? Even if you show up to others, it's not going to be full. When your cup is broken inside, how much ever you try to fill, it's not going to be full. So the more that you are longing to be seen, validated, appreciated, and loved, if you can bring the compass to yourself and start having that connection with you first, and then the support that you give outside, it blossoms and it is real and it is more authentic. Right? So most of the time we don't want to listen to solutions. We don't want any quick fix, or we don't want any solutions. We only want to be heard. Right? So we just be there, present, real, and authentic. I think that creates miracles and healing.
That's great. I love that. We only have a couple minutes left, so if anybody has a question. We have a microphone. Two questions. Oh. We're talking about taking the risk. Yes. Do you always take the risk, or do you
So, yes, I think you first. Can you hear me? Okay. You want to, when I say take a risk, don't just blindly jump out there, right? You still want to assess. When I mean taking the risk, it's when you've identified, here's someone that I want to talk to, or here's something, or someone that I found something in common with, or, you know, even in this conference, maybe I've heard a panelist talk about something that I want to approach and ask a question about. Being comfortable in saying, I'm going to walk up to that person. I'm going to, although I'm not, maybe it's not within my nature, maybe it makes me uncomfortable, maybe I get a little anxiety to do it, but I'm going to commit to myself, then I'm going to take that step.
Is there something you've learned from the experience of taking the risk multiple times?
Yeah.
I would just say I think what I've learned is that that's the hardest part.
Yeah.
Right? It's starting something. I think that's the hardest part. So once you realize, or once you engage in that risk taking more frequently, I think you'll see the benefit of it, because it's kind of like what's the best that could happen versus what's the worst that could happen, right? But I think to Michelle's point, you have to make sure that that risk is going to be met in a safe space, because what you don't want to do is further impact your ability to be confident enough to engage or take those risks.
That was wonderful. Very, very insightful and wonderful session. Let's give them a huge, loud round of applause.